rest of the state has already had opportunities to conduct these vigils. They were in-person vigils to honor the people who have died, friends and family members who have been victims of poor access to affordable health care. So there are a lot of stories already out there, but we at Wyoming Rising thought that it would be good to give the northwestern part of the state an opportunity to tell their stories, share their perspectives. I'm happy to welcome several guests tonight who have special insights from the medical profession, the clergy, and people who have actually worked diligently on the issue of Medicaid expansion. I'd like to give you just a little introduction. Most of you may know most of this, but to make it clear what our purpose is tonight. And for the last decade, Wyoming lawmakers have refused to expand Medicaid coverage to some 25 or 30,000 people in the state, most of whom are working and a majority of whom are single mothers. The purported reasons for this refusal have been that either the state can't afford it or the federal government will renege on their commitment to pay their 90% share of the cost of expanding Medicaid. Well, both those reasons have been refuted by the program's successful history in states that have adopted Medicaid expansion, including most of our neighbors, many of them Republican-dominated states. These states offer evidence that Medicaid expansion improves the state's fiscal, economic, and health conditions. And at the same time, it strengthens the medical industry. On top of that, if any of the 12 states that haven't adopted Medicaid expansion do choose to adopt it, the American Recovery Act would increase their federal match for traditional Medicaid, which amounts to quite a bit of money, about $34 million per biennium, according to the Wyoming Department of Health. And that would enhance the state treasury. So in the face of all this evidence, the argument that Wyoming can't afford to expand Medicaid simply won't hold up. So Medicaid expansion has become, in this state, an issue, sort of a tug of war between what I would call political identity and just basic humanity. For those on the radical right, it is no contest. Identity eclipses humanity. But there is a large core of legislators in the state who are sympathetic to the plight of the uninsured. Some of them even had a change of heart this last session. And as a result, the first Medicaid expansion bill in 10 years passed out of committee, even though it ultimately met defeat. So the key to changing hearts and minds, I think, is exposure to real people who suffer real hardships for lack of access to health care. I think most legislators and many of the public at large have health insurance coverage and travel in circles where that's never an issue. Our purpose tonight is to show them the other side. People who have suffered and died because they couldn't afford a timely diagnosis. Individuals who had to choose between paying for prescription medicine and keeping their small business afloat. Single mothers who as sole providers couldn't afford the premiums to ensure their own health. So with that, I would like to open up this discussion, invite if you have a story of someone you know or that fits this category, that would be great. We have our guest, Marcy Kindred from the Healthy Wyoming Coalition. Marcy is in Cheyenne, but agreed to join us to offer her moral support and technical support. Her role at Healthy Wyoming is to translate stories and narratives into effective communication, media communications for our state legislators and the public. Also, if you have a particular perspective or insight that you'd like to share, we'd like to hear that. Obviously, if we have a lot of people that want to speak, we want to be as concise as possible so that we can hear from everyone. So with that, I'll open it up and welcome your thoughts. Maybe I could start just to kick this off. Just to maybe give you an idea of what we're looking for. I lost a cousin a few months ago who to cancer. He complained of abdominal pain 3 years ago, but as a truck driver, did not qualify for Medicaid and couldn't afford the ACA premiums. So he didn't feel like he could afford to go to the doctor and convinced himself that it wasn't a big deal. Last year, it became unbearable. He checked into the emergency room and he had cancer all over his body, and there was he was treated for it, but it was too late to save him. Now he lives in Idaho. Idaho did finally adopt Medicaid expansion in 2020, just not soon enough to help my cousin. Anybody else? If you raise your hand, I could call on you. Paul.
Well, if you're just looking for case studies, in Cody, we still remember from 25 years ago, a kid whose abdominal pains were severe, but he knew that his mother could not afford for him to have any sort of doctor treatment. Anyway, the upshot is he had a ruptured appendix and died of the consequences of the ruptured appendix. I can't remember the name. Maybe Kate would remember, but it's something that has stuck with me and with so many others of my generation at Cody who remember that. It's just an egregious failure of our local system. Oh, Greg, you might remember that one too. I don't know.
Get Greg to unmute himself.
I don't actually recall that, Paul. I'm trying to, as you were telling that story, I was kind of going through my Rolodex of disasters that have occurred around here. But I don't actually recall that one. But so I may not have been involved. Hopefully it wasn't, I guess.
Thank you, Paul.
The issue, of course, is that it's entirely plausible whether we remember the name of the kid who did it.
I'm sorry, I didn't quite understand that last sentence.
I said that
we'll let Kate go ahead.
My name's Kate Murphy. I've been a public
got
health
lost.
nurse at Cody since January of 1990. I retired 3.5 years ago and loved it. And then COVID hit and I'm back at work doing contact tracing and COVID stuff. But in my career as a public health nurse, obviously most of my clients were in poverty level, almost exclusively with young families, mostly single mothers, lots of families in poverty. Also coordinated a genetic clinic for over 20 years here. Children who were difficult to diagnose or who had known conditions but needed management. So I feel like I know the community in terms of young families, lots of single mothers, but most important, young families who are intact mothers and fathers. In this community, it's very possible for a mom and a dad and 2 children who work full time, but if their income is at minimum wage, they qualify for everything because of their poverty level. My experience is that most of my clients were on Medicaid, but I know of way too many who are just in between that little bitty bit of being over income for Wyoming Medicaid, but can't afford health insurance. Luckily, the Affordable Care Act has stepped in and helped many of those. But in my experience, I've never turned away anybody. Of course, public health is free to everybody who needs it. But I would think that Medicare expansion that would just benefit those in-between families who work hard, are intact, wonderful families, do all the right things, and yet can never, ever, ever get ahead, ever. They're chronically living from paycheck to paycheck, one disaster away from complete disaster, financial and otherwise, and have no reason to hope or dream for the future. And dreaming and making plans for the future is just not a concept that most of my families that I've dealt with over the years have any experience with. And what a tragedy that is for human life. So I'm really glad that we're focusing on expansion of Medicaid. I would say that many, many young families are well served by public health nurses. Thankfully, not me anymore. But we have a cadre of vibrant young nurses who provide free prenatal and postnatal assistance, not medical care, but life enhancement. We provide free lactation consultation as long as parents need. And we will visit families in their homes as much and as often as mothers and fathers want us to be there. This is something that the state of Wyoming has invested in, and I applaud it. And with that, I can turn it over. If you have any questions, please don't hesitate to ask me. I feel like I have huge amount of hands-on experience with our families in poverty, huge amount. I've been honored and very happy to provide immediate nursing care to many of our young families in Park County over the years.
Thank you, Kate. Does anyone have questions for Kate?
Oh, thank God.
I did have the pleasure of talking to Dr. McCue, Greg McCue, who has joined us this evening, and he works with the free clinic. And I would be curious to know your perspective, Dr. McCue, and also how you would respond to some legislators who say, well, they don't need Medicaid expansion. They can just go to the free clinic.
Well, hi, I'm Greg McCue. I'm actually now a retired family physician from Cody. And I've been in Cody for about 39 years. And over the last 10 years, I've worked off and on for the Heart Mountain Volunteer Medical Clinic. And am one of the, clearly the lesser volunteers. There's a lot of physicians, there's some physicians in town that spend a huge amount of time there. The clinic is a free clinic providing medical care to people that are not, they don't qualify for Medicaid and they don't qualify for general health insurance. So basically our patient load is essentially who you're going to expand Medicaid for. About 80% of the volunteer or the patients in any volunteer medical clinic would qualify for Medicaid should it be expanded. And one thing that legislators misunderstand, and I think a lot of us misunderstand, if you're real poor, you get Medicaid. If you're kind of poor, you can get Affordable Care Act insurance for almost free. So it's like there's nobody that falls through the safety net here. Unfortunately, there is a space between those two programs where if you make too much money for Medicaid and don't make enough money to qualify for ACA, which oddly enough, you have to make a certain amount of money to qualify for the ACA. And those are our clientele. And that plus, that is our primary clientele. And anybody that might be on the phone call that is familiar with the Laramie Volunteer Medical Clinic, which is just a super organization. They deal with the same people, and it's the same 80%. And the people that volunteer or run these volunteer medical clinics are the absolutely kindest, best natured, best intended people in the state. But they will be the first to tell you that free medical care is not comprehensive medical care, and it's not free. Time and time again, I see patients. So how you been doing for the last 2 weeks? Well, I was in the emergency room last night, and as I was having, my ankles were swelling up and they had to go to the emergency room. So I'm providing free care to somebody that just ran up a $5,000 bill last night. And that person, and they don't forgive that necessarily. That person is still going to have to pay off that $5,000 bill because they weren't able to get into a regular doctor that works 8 hours a day, 5 days a week, or to manage the acute problems that come up day to day, and in people with chronic disease. And we do our very best, but we're not there. It's not a full-time clinic. And the other issue we run into is we have people that present with undiagnosed illness that require expensive tests to diagnose.
You were asking.
I see people, I said one fella in the clinic that had blood in his urine. Well, blood in the urine is a bad thing. It can be simple things that cause it, or there can be very bad things that cause it. So we've ruled out all the simple things, and we are pretty frugal and cost effective, but rule out all the the common explanations for human, for blood in the urine. And it gets down to, you need a urologist to look at that bladder and see if and where that bladder cancer is. And there is no frugal test for that. So we send them to the urologist, who, if we can get them into a urologist, will, rightly expect to be paid. And so those people are and either will just simply not go, or are running up thousands of dollars bill until they become obstructed. They go to the emergency room, and we gladly pay $50,000 for a major surgery, which is probably too late, but it's a palliative surgery. So I could go, I don't want to go going on and on and on, but I guess the fact of the matter is free clinics are not replacement for expanding Medicaid. Medicaid expansion will save enormous amounts of money in the intermediate term and long term for sure. And I would recommend that we try to get the people that actually run these free clinics kind of involved, and see what they can do to try to help advocate, because they really do care about these people, and they know we're not giving them the care that they deserve and can't. It's just the way it is. So that's sort of my 2 cents. And if we can get those kind of organizations involved, in addition to the mental health organizations, which expanding Medicaid will bring in a ton of money into the mental health arena, which again saves money down the line. And Warren may be able to kind of talk more about that. But the bottom line is, I think there's some organizations that we should probably be bringing into the fold if you can do that. So thanks.
Thank you, Greg. That's really helpful. You paint a clear picture that a lot of people probably don't understand. Marcy, I think if Greg is willing, we probably have a potential witness here down the road.
I just sent him a direct message on chat.
All right, good.
Yeah. I'd love to introduce myself if that's okay, and kind of my work that I'm doing. So I'm Marcy Kindred, and I'm with the Equality State Policy Center. They're a member of the Healthy Wyoming Coalition, a broad group of different organizations, of which Wyoming Rising has been a part of, that is trying to push through Medicaid expansion. And my job specifically is the story collector. And that's my title. My job includes finding folks who fall into this Medicaid gap and those that work with them, with these demographics of people, and helping them to tell their story, helping their story to be heard. I and Healthy Wyoming and the Equality State Policy Center firmly believe that we can throw data, and we have for 10 years. We've thrown data and we've thrown numbers, and we know that Medicaid expansion is good for the economy, it's good for the hospitals, it's good for everything. And we've thrown the stats at them over and over, and it's just falling on deaf ears. But it's really hard to look away from someone who's sitting there in front of you telling their personal story. Stories have the power to change not just minds, but hearts. And I'm working with the folks that are in the gap to amplify their stories, get them in front of legislators, whether that is in one-on-ones with their their representative. We're working on a series of those with different target legislators in Wyoming. I've been working on a series of op-eds that we're submitting to papers across Wyoming. I have background in public speaking, and I've been helping folks like with our vigils that we did across the state that were live and scary and had press there. I helped storytellers prepare speeches and practice. And so whatever venue and avenue that they feel comfortable telling their story in, it's my job to help them, to empower them to tell those stories. And I have so many stories that I could share with you today, but I do believe that my job is to help the storytellers tell their own stories. And why I'm so passionate about that is because I have my own healthcare story. So I'll share my healthcare story, if that's okay, kind of how I got into this work and what makes me so passionate about it is that I am one of those young families that Kate talked about that she worked with. 3 of my 4 children, ranging in ages from 13 to 3, all boys, 3 of the 4 were born while I was on Medicaid, on our Wyoming's current Medicaid. And Medicaid covers children from low-income houses and pregnant persons throughout their pregnancy until about 60 days, not about 60 days after giving birth, their insurance ends. And that's just barely enough time for those of us who have given birth. You're still recovering, but your health insurance is now gone. And I have a lot of personal healthcare stories. I'll just share this one specific that ties into mental health. I am a person who suffers from postpartum depression pretty severely. And after a couple of my children, it was debilitating, but it was undiagnosed. And I didn't even understand that I had it, especially with my first one. And I was not seeing a doctor regularly because 60 days after giving birth, I didn't have health insurance. And when you're scraping together to buy diapers and everything else, like your healthcare is put on the back burner. I know for a fact that had I been able to get the care that I needed and check in with my doctor regularly, I could have been given the support, gotten on the right medication, therapy, and my family's time in poverty could have been cut in half. And mind you, all the time that my family was in poverty and I didn't have health insurance, we were on food stamps. We were participating in the WIC program. So I know for a fact that it cost our state more in the long run from me not having health insurance. It put our family back. And so that's where my passion comes from. There are, I don't know how many moms in that position right now in our state that could be getting the help that they need. I feel like my family's position where we're at now is one part hard work and a lot more just being in the right place at the right time. I got my real estate license. I had some great mentors, but I never worked harder than when I was in poverty. Never. Even now, I'm working contract work with the Equality State Policy Center and full-time real estate agent, and I have 4 kids. I'm still not working as hard as I did when I worked in poverty, waiting tables. These people deserve health care. These people deserve health insurance. They are the hardest working people in Wyoming. And So that's what I do. I'm super excited, and thank you so much, Ron, for inviting me to this. And I love what has been shared so far. I'm going to put my contact information in the chat because I feel like there are some real great opportunities to get some more stories, and I'd love to help amplify those stories.
Great. Thanks so much, Marcy, for being here and sharing your powerful story. And I know you've turned a lot of heads in Cheyenne with those stories. I'm wondering if Warren would like to share his perspective while we have Kate and Warren with us.
Sure. I'm Warren Murphy. I'm a longtime Episcopal clergy in Wyoming and Cody. And I've also been involved in just about all of these issues of health, mental health. And I'm also the police chaplain in Cody. So I get to see a lot of stuff that a lot of people don't see of people who really need health care. And I'm also on the board and have been president of and director of the Wyoming, what is now the Wyoming Interfaith Network. And I need to tell you that we've worked on this in the past, Medicaid expansion. We've spent a lot of time in past years lobbying at the legislature and hearing nothing in return really, except, well, that's the government. You know, we don't want government money because they'll let us down. You know? And my feeling has been is that most of these legislators don't have any experience with poverty, low income people at all. Most of them come from pretty well-to-do backgrounds. They're business people. They're people who are in money. They have time to come to the legislature, run for the legislature, et cetera. So it's going to be a tough sell, and it could be back again this year. I think it will be. It almost passed again in the last session. It surprised everybody, but it could happen. Quality State Policy Center has been one of the real helpful groups in training people to lobby and do things. And as Greg brought up, he and I are both on the board of the Yellowstone Behavioral Center. We're seeing all these issues of mental health, and the police department sees it as well, because they deal with a lot of folks who are out there who really need supportive mental health. And they're usually poor, uneducated, or on drugs at the time, but nonetheless, they need that referral. So it's all out there. People just need to see it. And in Cody, one of the problems I think we've got is that this town is not necessarily this group on this call here, but people in this town just cover up poverty. They don't even want to see it, don't want to be informed of it. And so therefore, they're not going to be real enthusiastic about doing anything unless other groups are out there reaching that crowd, you know, to say that this is an issue. I think we're doing it better right now. With the suicide rate going up and people dying from COVID, it's starting to get some attention. I think that's more attention we need, sadly. It has to come this way. I always said in talks I've done on Medicaid expansion, you know, that a lot of people out there are just one hospital visit away from poverty. And, the Episcopal Diocese a few years ago, we brought it up and we passed it, surprisingly with some opposition. It surprised me, but we passed our endorsement of Medicaid expansion, so we're on record, and I would hope other churches would do the same, because the faith community needs to be behind that. I think I've said enough. If somebody's got any questions, I'll shut up too, just like my wife did.
Amen to that, Warren. Any questions for Warren, or questions regarding the Wyoming Interfaith Network? They are also a member of the Healthy Wyoming Coalition.
And the Apollo State Policy Center.
We have another guest that I have not met, Alisha Fehrenbacher. Did I get that right, Alisha? Alisha, do you have anything to add? I understand that you've worked on this issue extensively in Washington and Oregon.
Yes. Yes, thank you for, I've really enjoyed joining the meeting tonight and being invited. So thank you very much for the invitation. Dr. McCue invited me to the meeting tonight. and it's an honor. And I'm a Wyoming resident, so this is really important and dear to my heart to have Medicaid expansion happen in Wyoming. And I've had the privilege of helping with Medicaid expansion in Oregon and in Washington. So I hope to join the efforts to have it happen in Wyoming. So I want to just participate and be a voice and an advocate to have it happen here in this state, and bring my experience working on expansion here in Wyoming, but my efforts from Oregon's days and in Washington's days into Wyoming, really getting the bipartisan support and the importance of getting this important, I think, this important benefit to the state in place. I think that the benefits outweigh any negativity, and we have to get that. I think the storytelling that Marcy was mentioning is so important. And then the structure in place to make sure that that benefit is there will help the infrastructure of the state thrive. And it goes way past, I think a lot of people say, well, it's just to put money in the pockets of the hospitals and the providers. No, it's money and health in the pockets of the entire state. And I think that it's that entire vision and entire voice that has to be out there. And it is not a partisan conversation. It's about the people. It's about humanity. And I really do look forward to being a part of this conversation and making it happen, like not letting that vote go by without it being a passed vote.
Well, thank you. That's exciting, Alisha. And we welcome you to our growing army.
Thank you.
And,
This is.
if you're anyone willing to help, it won't take long for them to find you.
Thank you. I'm around. I also have a home in Laramie, so
Yes.
I can get to Cheyenne very quickly if I'm needed to be in Cheyenne to do any kind of door knocking, and I can get anywhere if needed. I knocked on lots and lots of doors in Oregon prior to ACA expansion. I actually knocked on everybody's door before that because we have businesses going out of business because they couldn't keep people employed because they didn't have coverage. And then in Washington, I helped get the whole waiver in place after Medicaid expansion. So I'm a fierce advocate because I was also a Medicaid child growing up. And I know when you go without and you have nothing, and I was the first child in my family to go to college. It's important, I think, to give back when you have a voice. So I'm here and ready to give back.
Great. Thank you. Any other comments or questions or thoughts that someone would like to share? Renee?
Well, I just have a story to share. My former brother-in-law he's still alive, but he was a blacksmith in Powell, and he was having a really tough time making money in Powell. And I tried to help him get on the Affordable Care Act health insurance, and he made too much money. Like it was like $20,000 a year is what he was making, which was too much money to get the subsidized Affordable Care health insurance. So he went without, and being a proud guy, he didn't ever want to ask for help. And he started suffering some sciatic nerves in his back, and he put it off. He didn't want to go to the doctor. He didn't want to pay for it. And he went on, and it got worse and worse. And he finally went to the doctor, and it was a tumor. It wasn't a sciatic at all. It was a cancer, and it was stage 4 cancer because he put it off for so long. So he did go ahead and go to lots of doctors, got all the scans and the treatments, and has an oncologist. And those people are never going to get paid. those physicians, those clinics. I mean, he's paying maybe what, $10, $15 a month to each one of them for, forever until, I mean, they're just never going to get paid. He eventually decided he needed to move to a state where there was Medicaid that he could qualify for. And because for some reason he couldn't qualify for Medicaid in Wyoming either. He was somewhere in that middle ground. So he moved to the East Coast to another state where he's has more care. But all the doctors that are here in Wyoming and all the clinics and the oncologists and the Price Cancer Center here in Cody are left holding a bill that's not going to get paid. So that's another, I mean, it's bad for the people, but it's also bad for our medical system as well. So that's the story I thought I'd share.
That's a good point, Renee. I understand that the hospitals in Wyoming lose $100 million a year in uncompensated care. So it's a number that rivals the total cost of Medicaid expansion, which is paid mostly by the federal government. So,
Right,
you're
and
right.
our rural hospitals are really the last organizations you want to put that burden on. So, yeah.
Exactly. Yeah.
I
Thanks.
have an opposite story. If you want to completely flip it on its head.
Great, man.
We were in London. I got up in the morning, I heard this thump, found my husband on the floor, unconscious, sweaty. My children, adult children were with us. So I said, call 911, whatever. So they called emergency services. We had an ambulance. I told them in the ambulance, I think it's a urinary tract infection. I want a UA. We got to the hospital. We had a UA. We had an EKG. We had a chest X-ray. We had a head CT scan. We got oral antibiotics. And every step of the way, I would say, do you want any information? Do you want our insurance? Because my husband had purchased medical insurance for the trip. Does anybody want this? And everybody just looked at me in a puzzled expression and said, no, I don't think they want that unless you're admitted to the hospital. We did not pay one dime for any of it. Ambulance, chest X-ray, EKG. In fact, I think we had 2 EKGs, head CT, even the antibiotic. I tried to pay for that. She said, oh, no, he's over some age cut, 65 or 70, I don't know what it was. Oh, how old is he? Oh, no, you don't have to pay for any of it. So how about that for the opposite extreme? And we wanted to pay. We said, look, we have an insurance. We want to pay you. No, it's all free.
It sounds like a utopia that's far away from Wyoming. Well, any other comments? Mary, you asked about the mechanics of the legislation. My understanding is that Joint Revenue has already drafted a bill. In fact, they tried to get it into the special session, but it was failed introduction. But they will sponsor this bill in February, and it's to be heard by the Appropriations Committee. So we have 2 committees that are involved in the nuts and bolts of funding state government, and I think that's works to our advantage, at least to get the bill out to a vote. The prospects, as usual, don't look great, particularly in the Senate, but we have between now and February to change that landscape if we can. If we can't, we have the opportunity to replace some of the recalcitrants in the legislature.
And
Go ahead, Mary.
I did have one because the pragmatic part of me, in part, I wanted to ask Alisha, and I'm also looking over at Marcy, and I'm thinking, so the plan between now and February, I have never knocked on a door. I have largely given up contacting my own local representatives, but I'm getting over that. Wyoming Rising is helping me get over that. What door do you knock on? How do we become the force that needs to happen between now and February?
So Healthy Wyoming does have some, especially with Better Wyoming, they're the grassroots leg of Healthy Wyoming. They do have some plans coming up, and I'm not sure, Ron, I'm more like, I know what's going on in Cheyenne and Laramie County down here. Do you have a chapter? And is everybody from, I'm sorry, I should know these things. Where are we all from the same county? We're all from Park County? Okay. Yeah, I'm trying to think.
Also, I will also share that I have a home in Lincoln County as well. So I can also knock doors there with the legislators. So I've already started making contacts with some of the legislators there because I know there's a heavy resistance down there in that area against it. So I've already started, I started about 1.5 years ago there with my contacts because I knew that we have to get Medicaid in. So yeah, so I'll stop. I just wanted to let you guys know that.
That's amazing.
Right.
Where have you been, Alisha? We're so excited to have you. So we've been knocking on doors in Cheyenne. We've been knocking on doors in Affie Ellis's district all summer. It's cold now. So we're doing some postcard writing parties is what we're calling them. I know that Better Wyoming is getting ready to roll out a postcard mail out campaign. So you can write to them, request postcards, and they will send you like a postcard party packet, which will have everything you need to get a group of your friends and a bottle of wine and just write target legislators or your own legislators to get those going. We are planning a week of action leading into the legislative session in February. So ending with a rally at the Capitol, either the day before it's up in the air. We're having some discussion on what day would be better to have the rally, the day before when all the legislators get into town and they're not quite buried in the session yet, or if we just do it opening day just for the show. We may not be able to talk to legislators that day, but we will have a big showing at the Capitol. But we will have a full week of action with action items to participate in across the state. If you are not on Healthy Wyoming's mailing list, I would jump on healthywyoming.org and sign up for their mailing list, where they send out they don't spam you. It's just regular updates about actions that are happening across the state. I'd get on that real quick. That's the best way to stay plugged in with that aspect. And they're always looking for folks to lead some of these grassroots activities in different counties. So there's a place where you can reach out and say, hey, we want to do a postcard party in Park City. So yeah, I mean, Park County. So yeah, any other questions? Did I answer some of that, Mary? I don't know of anybody that's knocking doors where you're at the moment, but you could start a group.
And I don't know if knocking on doors, I get the image of along a street, but do you mean the doors of legislators? Who do you knock the door?
So what we've been doing right now is we've been knocking on doors in target legislators' districts. So Affie Ellis has been flagged as a possible. She's very politically savvy and doesn't say one way or the other. But if we can make her feel like it's politically advantageous to pass Medicaid expansion. So we've been putting the pressure on her through her constituents and knocking on doors in her district and saying, you need to contact Affie Ellis. I've gotten a lot of storytellers from her district from knocking on doors, and we are trying to arrange a one-on-one meeting with her, with some of her constituents that fall in the gap or work with people who fall in the gap. So yeah, so we haven't necessarily been knocking on the doors of, we've been calling and writing to specific legislators. I've had many interactions with my senator, Lynn Hutchings. We're good friends now. I don't know if she'll ever change her mind, but I won't. She's my legislator, so I can't give up. I'm just going to keep bugging her.
Can you name names? Can you name names? Who are the legislators who are most reluctant right now, who we need to hit up or work on?
So I think there are two different categories. There are legislators that are the most reluctant that we've kind of put on the like, don't waste time. And actually Senator Hutchings is on that list. But because I've grown a personal relationship with her, I'm going to keep continuing that. But we do have target, and I am not the greatest because I am with the grassroots, and I know like my specific legislators, we have our grass tops work with the Healthy Wyoming, and they have like a whip list of the target senators. I'm trying to think of we would like to mitigate the Ogden Driscoll sabotage. I don't think we're ever going to get him on board, but we would like to. I don't know if you saw his op-ed recently. Good. I hope it wasn't widely circulated. He has, for some reason, made this his hill to die on, that Medicaid expansion is bad for the state. And he's not just voting no, he is being very loud and public about it. We think it's because he has, he's going to have a very tough primary coming up. And so he has decided that this is how he is going to appeal to his conservative constituents. So we're working in that district specifically to try and make him feel like maybe he should not be so loud, like this is the wrong political move to be so against it, that you're actually going to lose votes. I'm trying to think of who else we've been targeting. Representative Sue Wilson, that's not helpful to any of you. I'm not familiar. I wish I should have gotten more prepared for this and had legislators that you care about and know more about your legislators. But if I get someone to get Ron a list, or Ron, do you have more information? Maybe you have more to say on this than I do. I'm rambling at this point.
No, I don't really. I know that they do keep a list, but I haven't looked at it lately. During the last section, we had phone trees. We called specific legislators that we thought could be influenced, and I think that was somewhat effective. But we haven't really gotten that far for the 2022 legislature. But Wyoming Rising members can be assured we'll be asking for their help when that time comes to make those phone calls, both in our districts and across the state. So, but thank you, Marcy. It's helpful to have that perspective. Well, we've used up an hour, and I
wanted to put in 2 cents that at the last legislative session, the Senator Coast is actually from Powell, I believe.
RJ Cox
Expressed support of expanding Title 19 right from the start. I mean, when I sent him a letter, and I think there's a couple of them that are against it, but maybe influenced, I think. And we've got Tim French that I'm not sure I'd waste a lot of paper on.
Is Ed Cooper up there?
Yes, this is Phyllis. Yes, we met, a group of us met with Ed Cooper this last summer, and I think he was definitely not super negative. He was, he just became a senator. He's not been there long, but he was open for discussion. And I think I haven't talked to him lately, but he seemed open to the argument for sure. I mean, to the stories and all.
So
That's
this is so I would love to have some talking points that we have that would be agreeable for the group that we could talk from. So maybe, I don't know if you have those that could be shared, but that would make, I think, going out to do the outreach a little easier. And that's what I think that worked really well for me in the past, both in Oregon and in Washington when we were doing our outreach with Republicans and the Democrats. We were lucky that we had Republicans carry some of the water and then have bipartisan support from the House and the Senate. In Oregon and then in Washington, we had a lot of resistance from the Republicans, but then we got support, and then we were able to really work across the party lines. So I think the talking points are really important. What is important to both sides, and bring everyone to the middle, is going to be the driver for getting this done. And then what are the outcomes we expect at the end of it? Because then what would the state want to do with expansion? Would the state want to go for a waiver? Because that also helps support the state's infrastructure and economics. So I think the talking points are going to be key. We want to speak off that same card when we're talking across the state. That will drive the message.
And we definitely have some resources with that. Like with these small groups that we're meeting with legislators, we've been aiming to have a member of clergy, a policy guru that knows all the policy and all of the numbers, as well as storytellers that fall in the gap, business owners that would benefit from it. So we try to have groups, and we have meetings with these groups to prep them with the talking points. So yeah, we have these resources. It gets me so excited hearing like, yes, we're on the right track.
Yeah. And I am very happy to get right in front of the legislators, right in front of them.
very good. Thank you. I'd like to close on a positive note, if I could, and that is to envision what things could be like if we succeed. And I found a really good example in the state of Louisiana, which is a very red state. They just celebrated 5 years of Medicaid expansion. And I have a dozen stories, but let me just read one story to you that I think epitomizes the value of this program in Louisiana. This person says, I lost insurance coverage for about 5 to 6 months and then applied for Medicaid expansion and was able to receive it. I went to the doctor in August and then to a cardiologist to see if my stent was working properly. While there, the doctor performed a scan on my carotid artery and found that I had a 98% blockage on one side and 99% on the other. I had surgery in December on the left side and in February on the right side. Without this, I would have had a stroke and died. Had I not had insurance, I would not have gone to the doctor. This insurance saved my life. I hope that we can soon hear stories like that in Wyoming. Thank you all for attending, and we will look forward to your participation in this campaign.